Hello and welcome to At Brookings. I'm Gigi Hinton. There's more than $1 billion in the stimulus package for comparative effectiveness research on healthcare reform. Senator Max Baucus and Office of Management and Budget Director Peter Orszag shared their views on this topic at a Brookings event. And the situation in Afghanistan and Pakistan are high priorities on President Obama's foreign policy agenda. Senior fellow Michael O'Hanlon hosted a panel discussing NATO troops in the area, rising insurgency, and securing those regions. And should the federal government be in the car business? Well, that's the question the man on the street answers. And all that's next at Brookings.
This is At Brookings, a review of news and events for the week of June 8th, 2009.
Afghanistan and Pakistan remain countries in strife, and President Obama has pledged continued support to help bring stability to the region. Senior fellow Michael O'Hanlon led a panel of experts in a forum on the future of these two war-torn countries.
Pakistan has now become the epicenter of the global Islamic Jihad. The stakes here are enormous. 175 million Muslims, the second largest Muslim country in the world, the fastest growing nuclear arsenal in the world, and a hothouse of terrorist groups that is really unrivaled anywhere else in the world.
The overall problem is that there really is no unity of command in Afghanistan. So we're unable, and this is true even in just the southern region, so NATO is unable to prioritize and to shift resources to deal with the most important problems.
It's become a cliche to say in Washington that Afghanistan, the effort in Afghanistan cannot succeed without addressing safe havens in Pakistan. And that what's happening in Pakistan is critical for the insurgency in Afghanistan. And no doubt this is true. I would add here, however, that the insurgency in Afghanistan is internally sustaining in Afghanistan itself today.
What do I think of the government going into the automobile business? I'll tell you, I'm of two minds on the whole thing. Number one, I think that if you're going to live by the free market sword, you need to be prepared to die by the free market sword.
General Motors and Chrysler, in my opinion, probably should have been allowed to go not into Chapter 7 bankruptcy, but Chapter 11 bankruptcy, even though there are so many people who depend upon that company for jobs.
We have to think, why don't they have to deal with their previous actions?
I'm not persuaded that automobile manufacturing is the wave of the future.
And that's what I think.
With a deadline for legislation due in the coming weeks, the administration's push for healthcare reform is underway. At Brookings, the Engelberg Center for Healthcare Reform and the Hamilton Project hosted a discussion on comparative effectiveness research and its impact on healthcare practices and costs.
In 2008, America spent $2.4 trillion in healthcare. That's 1/6 of our economy. Yet we ranked last among major industrialized nations in the Commonwealth Fund's National Scoreboard on health system performance, which ranks the number of deaths that could be prevented before age 75 through effective health care. Last. The United States ranked last. Some analysts estimate that as much as 30% of our spending is for ineffective, redundant, or inappropriate care. That's care that does nothing to improve the health of Americans.
We conceptually know, based on the work that has been done here at the Institute of Medicine and elsewhere, the types of things that seem the most auspicious. We are trying to do as much of that as possible, and then perhaps just as importantly, put in place a change in the process so that we can keep up over time with an evolving healthcare market.
I've been around economic issues in various regards for a long, long time. And I don't think there is any question that it is absolutely imperative that we have major reform of our healthcare system to address wasteful expenditures, to reduce the rate of increase of healthcare costs, to improve outcomes, and absolutely critically, to move toward accomplishing universal coverage.
At Brookings is produced by the Brookings Institution. To learn more about the issues discussed on At Brookings, visit our website at brookings.edu.